You can take us away, Julie.
Are we ready? Hello, everyone. Thank you and welcome to all of you who are listening to this forum. My name is Julie Snyder, a member of the League, and I will be the moderator for tonight's League of Women Voters Candidates Forum, featuring the 4 candidates for the position of Hospital District 2 Commissioner, positions 4 and 7. Mick Sager will not join us this evening as he has withdrawn from this race. Note that his name will still appear on the ballot due to the late timing of the withdrawal. Hospital commissioners are responsible for the policies and quality of care at the Olympic Medical Center and its inpatient and outpatient services, as well as major divisions, including OMC Physicians and OMC Health, Home Health. I'd like to thank these 4 candidates, Carleen Benson, Tara Coffin, Laurie Force, and Penny Sander, for taking their time to participate in our forum this evening. Voting is the cornerstone of our democracy, and I appreciate the time you're taking to listen tonight. There are many volunteers working to keep things running as smoothly as possible, and I'm grateful to all of them, including Sarah from the North Olympic Library System. We are recording this forum and will be posting links to them on the League's website, www.lwvcla.org, within the next few days. We're also posting the links on our Facebook page. Over the past month, we've received thoughtful questions from the community. So the questions you hear tonight are your questions, and we thank everyone who took the time to submit them. In many cases, multiple people submitted similar questions, and we did our best to combine the questions in a way that allows us to cover as many questions as possible on a wide range of topics in the time we have this evening. Before we begin this forum, we made sure that all candidates were able to see our timer, and now we'd like to put that to use. Each candidate will give a 2-minute opening statement in the order the candidates will appear on the ballot. After that, we will move to the question portion, where each candidate will have 90 seconds to answer the question, starting in the order the candidates will appear on the ballot, and then alternating on who will answer first. At the end of the forum, each candidate will give a 1-minute closing statement in reverse order from the opening statement. We will now hear each candidate's opening statement. Please tell us why you are running for the Hospital District Commissioner 2 position, what your qualifications are for serving, and what your goals are while in office. Carleen Benson, you will go first and have 2 minutes.
Thank you so much for having me at the forum here today. I'm Carleen Benson, and I'm running for Clallam County Hospital Commission position number 4. My healthcare career started in the Army in 1975. I was a physical therapist in the Army in Texas. And after a few years, my husband got transferred to Albuquerque, and he said, there's a medical school here, you should go. So I used my GI Bill and went to the University of New Mexico and got my MD, and I stayed there and went through the urology residency. Well, when I was finished with residency in 1992, our sons were 2 and 5, and we wanted to move somewhere where there were good schools and great outdoor activities. So we chose Port Angeles. So we came here in 1992 and have been here ever since. I started in private practice and then became employed by the hospital and worked for 30 years as a urologist in this community and loved every minute of it. I retired in 2023. And then shortly after that, the 2 other urologists in the practice decided they would quit. So we had no urologists here. So last summer, the hospital called me up and said, hey, could you come and keep the doors open in the clinic until our new people start in October? And I said, sure, I'd love to. So I went back in last summer, and then the new people started in October. Well, by then we had 500 patients on a waiting list. So they asked if I would stay a little longer and see people in the office. So that's what I do, 2 to 3 days a week. I see people in the office. I also work at the jail 2 days a month. And I realized when I went back to work, I absolutely love taking care of patients. This is what I love to do. Other things that I have done. Oh, and I will probably be done with this gig of working in the clinic in September when our third urologist will be starting. So, oh dear, I have to stop.
Thank you. Tara Coffin, you now have 2 minutes.
So first of all, thank you to League of Women Voters for Clallam County for hosting this forum. I'm really looking forward to the discussion tonight. My name is Tara Coffin, although I respond to Tara also. It's a lifelong struggle of having my name mispronounced. But I'm honored to be here tonight as one of the candidates for the hospital commissioner position 4. My work leading up to this point has largely focused on clinical research. I just lost my notes. It's the initial jitters of trying to like orchestrate all of the windows and everything that are open. Everybody's feeling it that's presenting and talking tonight. But that said, the majority of my work has relied on or has focused on advancing public health in various capacities. While I've not previously held public office before, I do bring extensive experience in clinical research and work as a health communications specialist at major healthcare institutions throughout the US. I earned my doctorate in public health and master's in education from University of Washington, and I grew up in a small community in Western Washington, so I'm 100% proud Washingtonian. I firmly believe that access to preventative care is crucial for good public health. Early intervention, regular screenings, community education at each stage of life and at every opportunity has the ability to make an enormous impact both on individuals within our community and the community at large. And as commissioner, fingers crossed, I will advocate for expanding preventative services, securing and trying to keep what we have here while growing it in a way that's sustainable, so every resident of our county can benefit from proactive, cost-effective care that supports a healthier future for all. So I'm, again, thrilled to be here and really looking forward to discussion tonight and appreciate everyone's patience through my initial fumbling.
Thank you. Laurie Force, you have 2 minutes. Laurie, can you hear me?
Yes. Can you hear me?
Yes, you have 2 minutes.
Okay, my CPU usage is up and I don't want to crash, so I've turned off my video.
Okay.
As an active retired nurse practitioner, I have centered my practice around patient advocacy and collaboration with patients, families, and team members. As a healthcare provider, I routinely deal with uncertainty and am always encountering new situations where I must reach out to the experts and dive into the literature. I believe wholeheartedly in sharing knowledge and in shared decision-making. I see the role of the hospital commissioner as expanding on all of these basic commitments. I see our community as the patient, and I am a member of this community. Our hospital is in dire straits that have only worsened with the passage of the Budget and Reconciliation Act. Medicaid reimbursements are going to decrease. More uninsured patients will be arriving in the ER, leading to even more unreimbursed care. SNAP grant funding had just begun to ease the financial strain, but that too is under threat. Our state budget is also severely constrained, and it's unlikely to make up the difference. We can't change our payer mix, and very few options exist to increase revenues. There will be hard choices and cuts ahead. We must face this situation squarely as a community and decide if we want to make the hard choices ourselves or have an outside entity make them for us. We must continue to find efficiencies. It's time for community forums and outreach. It's time to discuss the trade-offs involved in working towards critical access status. Thank you for this opportunity to address the League of Women Voters and the community, and I ask for your vote for position 7.
Thank you. Penny Sander, you now have 2 minutes. Penny, you need to unmute. Penny, we can't hear you. We cannot hear you.
There we go.
There we go.
First of all, thank you, Julie. Thank you, League. Very pleased to be here this evening. I come with a little different pedigree here. I was appointed an OMC commissioner in March of 2025 to fill a position that was vacated by a commissioner. And as such, with the appointment, I have to run to fulfill the 2 years. And I'm here asking for the community's support to let me finish the 2 years. I've lived in Clallam County for 20 years, and for 15 of those years, I have been an elder advocate in the community. I have spent hours and hours at OMC and in the varying physician offices. I've also spent a lot of time in our emergency department. So I understand as an advocate and as a member of this community how critical having care in this community is. I've also known what a challenge it is when people have to go off the peninsula for care. I don't want that for us. What I want for us is to create a stronger, more accountable, more responsive Olympic Medical Center that is in our community, serving our community, and supported by our community. I frankly want to finish what I have begun. And I am committed that in this term, that we will build a stronger OMC. Thank you.
Thank you. Okay, now to the question portion. The first series of questions addresses OMC finances and the strategic partnership process. Question number 1, please speak to your understanding of the current OMC budget and financial shortfall. What do you think OMC can do to remain viable? Ms. Benson, you go first. You have 90 seconds.
Well, as one of the other people in the forum have already discussed, finding new revenue streams is going to be very difficult. We can't change our payer mix. I think we really need to look at the candidates that they have been promoted that are interested in partnering with or buying our hospital, or the possibility of becoming rural critical access or partnering with Jefferson. There hasn't been much information left to the public, so I don't really have a lot to say about that at this time. I'm really anxiously awaiting the information from Juniper, the company that brought all of these people into the room to talk to our hospital.
Thank you. Ms. Coffin, you have 90 seconds.
All right, so I'm operating on a public level understanding of what the budget looks like also, but looking at other rural hospitals, the story of OMC is not terribly unique, unfortunately, across the United States. So being able to look at what other public hospitals and rural communities have done, and also thinking about ways to streamline and make care more cost effective. It's not just about what can we bring in terms of revenue, it's also thinking about things like having somebody go to the emergency room for primary care, which is something that is common in individuals who don't have an established primary care provider or who are underinsured, is more expensive than just having somebody make an appointment with their primary care provider. So if we're able to think about some ways to improve health literacy among the public and thinking about what individuals within the community can do to help to preserve OMC as it is, on top of looking for other, sources of revenue as well. I think it's a really smart way to go about just thinking about how triaging can be improved. So folks are getting to the right person at the right time rather than waiting until things are more costly. I think there's a lot of ways to just sort of review and revise how we as a community approach care and to emphasize preventative care as much as possible, because an ounce of prevention is certainly worth a pound of cure.
Ms. Force, you have 90 seconds.
Can you hear me?
Yes, we can hear you.
Excellent. Yes, the current financing situation is really serious, and the budget information that I've seen at presented at meetings is not including enough information to provide the data we need to make good budget decisions and decide on efficiencies. One example of that is there's regular presentations regarding how many procedures, ER visits, admissions, etc., are happening in the hospital, but there's no dollars associated with those numbers. And I don't see how you can decide where the problems lie without that level of information. And the finances beyond that, like we've already said, are very much constrained on the positive side. About the only option out there for actually increasing revenues is a critical access status, and it has not gotten the discussion it deserves, and the public is not aware of the trade-offs. As to, I ran out of,
Excuse me, your time is up. Ms. Sander, you have 90 seconds. You need to unmute.
Yes, thank you. Yes, the financial picture at OMC is very challenging, and there have been a lot of problems. What I'm happy to share with you this evening is that the board is absolutely committed to turning around the financial picture for the hospital. We understand there have been problems in the past, and we have to not always focus on what was in the past, but to focus on what we can do in the future. There are a number of items that are being discussed. There have been a couple of things identified, and they include, first of all, better financial practices overall, which will include more information, more communication to the community as to the financial position of the hospital. And then within the hospital, refocusing on what are our services to the community and how can we expand those services in getting more and more people to come to OMC to have their care, their full range of care at OMC. And what are about the strategic partnerships? The strategic partnerships are essential to the future of OMC. Because I am a board member, I'm not at liberty to discuss those strategic partnerships, but just to simply say to you, they are focused on community care and how we can expand services. Thank you.
Okay, question number 2. What are your priorities in selecting a partner for OMC? How does this align with the broad strategic selection priorities? Ms. Coffin, you go first. You have 90 seconds.
Priorities for selecting a partner for OMC. I think in considering some of the potential options for partnerships that are out there, again, operating with a public level knowledge on what those partnerships look like. The focus would be on ensuring that Olympic Medical Center and the community and Peninsula at large can maintain a high level of autonomy and sort of having a good sense and being able to say, this is what the community needs. I think that's incredibly important, and it seems to be something that I've heard echoed throughout the community as well, is that, it's one thing if somebody is coming in as a partner to OMC, it's another thing if they're completely changing everything that we know to be OMC within our community. I would pair that with making sure there's a strong understanding of what the absolutely essential and high use services for our community are, and making sure that those are the types of services that we can keep on the peninsula, and to avoid having people to travel into Seattle for different things, and increasing travel times, which negatively impacts access to care, since not everybody has the ability to drop everything at a moment's notice and travel, the 3 hours. I know me in particular, I have 3 kids, and having to go to Seattle Children's is a nightmare. So if I can do it here, I want to.
Thank you. Ms. Force, you have 90 seconds.
I have trouble finding that unmute button. Okay, so in terms of my priorities for partnership, I feel it's essential we avoid any private equity relationships. It's been shown all over the country, and there's a recent January budget statement from Senator Grassley and Senator Whitehouse that really spells it out in detail. Private equity will cost care, cost services, and typically reduces quality for everybody in the community. I would prefer a partner that would keep us as local as possible. I don't think any partner is going to be providing a lot of funding to keep us going. They are going to expect us to make cuts. They're going to help us make cuts to meet our budget problems. And so looking at it from that perspective, it's easier to partner with another public hospital like Jefferson. And it's also easier to have a more informal alliance such as University of Washington. So those are my preferences.
Thank you. Ms. Sanders, you have 90 seconds.
Thank you. Again, I will say, because I am sitting on the board, I'm a bit constrained, but let me say, as the board, we have looked at a number of issues, but we are fundamentally absolutely committed that whomever we partner with, the goal is to strengthen OMC and its presence in this community. What does strengthen mean? It means strengthening it both financially and in the service arena. That is so important. One of the issues is always a discussion of bringing more specialty care into our community so people do not have to travel off the peninsula. And so we will be looking at partners who can provide that specialty expertise and provide it here in the community. We're also looking for partners who, nobody's going to write us a check. This is not a climate in which anybody's going to ride in with bags of money. So let's just take that off the screen. But we are looking for partners who can help us be more financially astute. And this would include opportunities for cooperative efforts in acquisition of materials and other resources that are desperately needed in this community. But most of all, the focus has to be on excellent care in this community. Thank you.
Thank you. Ms. Benson, you have 90 seconds.
Thank you. Well, I don't have a whole lot more to add. I agree with what the other candidates say. I do have concerns about private equity firms. I've talked to physicians who've worked for hospitals that have been bought by them, and their standards are pretty strict as far as seeing an outrageous number of patients a day. And, in order to make money for this organization. And I don't think we need to be looking at people that are looking at us as a golden goose that's going to lay them a few golden eggs. So I would really like to see us partner with somebody with a good reputation like UW, and maybe provide us with some of the specialty care out here, or like Jefferson, and go with this if there's any way we can get the rural critical access money would be awesome. But I think it's going to be critical to look very carefully at any of the potential partners or purchasers or to make sure that their priorities are our priorities to provide excellent care to people of the North Olympic Peninsula.
Thank you. Our next question, do you support OMC becoming a critical access hospital, which means limiting to fewer than 25 beds? Ms. Force, you have 90 seconds.
I wouldn't go as far as saying support, but I believe the option needs to be explored deeply and publicly. This is not any of the issue this is not an issue that should be in any kind of agreement. What are they calling them? The non-disclosure agreement. And I think the public needs to look at the positives and negatives of this. There are ways to expand the inpatient side that are strictly limited. These include 25 acute care beds plus 5 freestanding birth center beds plus 10 beds that are dedicated to psychiatric care and 10 beds that are dedicated to rehab. And that means we have a lot more options than just the 25 beds themselves. I'm just imagining here, if there was a partnership, for instance, with Jefferson, and there could be shared resources in that way too. Critical access also doesn't happen overnight. It's a process. It takes several years to get there. And in the meantime, we need to do all our other due diligence to make our finances better and see if it's the right option.
Thank you.
Thank you.
Ms. Sanders, I'm sorry, you have 90 seconds.
Thank you. Critical access hospitals are certainly something that should be discussed here, but in the context of a total care spectrum. There are a number of critical care models across the United States that they're called critical care hospitals, but they have significant other entities within that hospital. This is a model that certainly should be looked at. Critical care is actually a definition. All hospitals provide critical care in every aspect of what they do. But what is being discussed or will be discussed is how do we use that critical care access definition, which allows for a much more attractive reimbursement model. How do we use that critical care definition within the context of the kind of comprehensive care that needs to be offered at Olympic Medical Center? Remember, we're it for 90 miles. This is not like a community where there are 4 options. We're it. And because we're it, we have sweeping responsibilities to our community. So critical care access needs to be looked at in the totality of all responsibilities. Thank you.
Ms. Benson, you have 90 seconds.
Thank you. Yeah, I've been toying with this idea of making our hospital critical access for a number of years. From a surgeon's standpoint, our surgeries are now, a lot of them are done outpatient. Or a 23-hour stay is what they consider outpatient care. And, so we wouldn't lose a lot of our surgical opportunities if we do go to a critical access model, because we wouldn't need so many beds for post-ops. But then we've got all the other stuff, the mental health, the people that are hanging out in the hospital because they have nowhere else to go. And we really need to get a handle on that if we're going to decrease our inpatients to 25 beds. We also definitely need to keep at least 5 obstetrical beds available, because as you say, we're it, and we need to have obstetrical care here. Hard stop. Absolutely. So I think it's something we can look into. It certainly is attractive to get the reimbursement for Medicare, Medicaid, and TRICARE that the critical access hospitals are getting. And that would solve a lot of our financial problems. So it's something that we should definitely give a good, strong look at.
Thank you. Ms. Coffin, you have 90 seconds.
My short answer is it gives me the ick. And the reason being is that I was 2 years ago when my third kiddo was born, I was taking up one of those obstetrical beds. And when we're thinking about, I mean, a critical access hospital status is taking it down to the bare bones. And while that may be sustainable, it's only sustainable for the community if you assume that everybody in the community has the means and the mechanisms to go farther for specialty care, or if they do have to stay in a hospital for longer than is sort of ideal within the critical critical access hospital model. So I think that in my opinion, it is ideally an option of last resort. I think there's a lot of different ways to approach this issue of ensuring we can keep those types of specialty care and advanced care options available within our community and strengthen them as a way to reduce higher healthcare costs, as opposed to let's just get rid of all the services and hope that it goes well. I mean, and that I don't mean to make it sound so flippant as that, but I think that there's a lot of people in the community that would suffer if the specialty services and advanced care that we do currently have available was lost because of a shift to a critical access hospital. Sorry, bumbling my words.
Thank you. Okay, our next question, our last in this group. If elected, how will you balance the non-disclosure requirements of the partnership strategic process with the public's interest in more information on process and goals? Ms. Force, you have 90 seconds. No, I'm sorry, excuse me. Ms. Sanders, you have 90 seconds. You go first, yes.
I think while I appreciate this question, I think this question is going to be answered very much in the short term, as we are coming to the point in the process, which has been a long and very comprehensive and a very serious process, that information regarding what the options that we have under final review will become part of public information. It is important, and I'm going to reiterate this, it is important to understand that there were principles outlined in the proposal that was sent out to many entities, that there were certain things that the proposals had to reflect. It had to reflect comprehensive care. It had to reflect maintaining employment in the community. It had to do with creating greater opportunities for this hospital. So all of the proposals that have been reviewed reflect these basic elements. So I look forward to, in the next period of time, that everyone will have the opportunity to look and to make comments about proposal, and we'll move forward from there.
Thank you. Ms. Benson, you have 90 seconds.
This has been a very difficult thing. I've gone to several commissioners' meetings the last couple of months, and people want to know about it. And there's been this sort of uh, curtain dropped over what's going on, and we can't say anything because of non-disclosure. I'm very much looking forward to when that is lifted, because I think the public needs to know. And I think that it would be great if the public could have some input into what's going on and who we partner with or be absorbed by or whatever this is going to look like in the future. I think I understand the reason for the non-disclosure, but on the other hand, it kind of rubs me the wrong way because I would really, really think we need to know this as the public. And so I would encourage the current, if I get on the board, I would encourage us to be as transparent as humanly possible, to engage the community as much as we can in helping to make these decisions.
Thank you. Ms. Coffin, you have 90 seconds.
Thank you. This is a great question, and this is sort of my jam is public health communication. And one thing that I want to really highlight is that communication happens in a lot of different ways, and it is not just a board to the public situation. There's a lot of ways to engage the public and to engage individual community members and community groups. Both seeking input and providing a multitude of venues where input can come in. And then while there's certainly things that can't be disclosed because of some of the strings being tied around the non-disclosure for the partnership exploration, there are opportunities to say, this is why this is not information that can come out right now, and this is when you might be able to expect it. Being really forthcoming with the Penny highlighted some of the outline pieces of this is what we were looking for. That's the kind of information that I feel like is something that could be shared with the public, but just really solidifying opportunities to share. And to have exchange, to have back and forth conversations between the board and the public and the hospital at large. A public forum, Q&A type opportunities that are included in current commissioner meetings, I think is one way, but that's a pretty small slice of the community that's able to engage in that setting. And I think there's opportunities to expand and create some more room for engagement. And again, back and forth communication.
Thank you. Ms. Force, you have 90 seconds.
Thank you. What Tara said really resonates with me. I think that the NDAs legally are tie our hands a lot. However, if we can focus more on process and outreach, the public can be more informed about why we're seeking certain types of partnerships, and having that community engagement is just essential to community buy-in. There's a huge risk here with too much non-disclosure of creating a permanent and deep rift in our community, and I would hate to see that. I really would. Thank you.
Okay, our next group of questions addresses decision-making and service choices. The first question is, to what extent are elected officials expected to take public comment into consideration when making decisions, and how are they to balance it with other sources of information? Ms. Benson, you go first. You have 90 seconds.
Well, I think community information is important. The hospital asked for an increase in the levy just recently, so the community is financially invested in the hospital. They deserve to be part of this whole process. We need to listen to them as a hospital as to what people need and want. We just can't assume that we know everything. I kind of think I know what urology services we need in this community, but that may not be the case. I would like to hear from the public as to what they feel we need. I know it's been very difficult to hire people in certain specialties like cardiology, neurology. These are huge needs in this community. But unfortunately, there's not a whole lot of those people laying around looking for work in a small rural community. So, but it would be good to hear from the public on a regular basis, whether it's a community survey or showing up at meetings or whatever, but whatever they want, whatever the public is interested in, even a forum like this is also a really great option to find out what is the need in this community, what the perception of the community is.
Thank you. Ms. Coffin, you have 90 seconds.
I love this question because it's all about like engaging with the community and talking to people and getting a good sense of what is actually needed versus what somebody in an official position is assuming a community needs. And I think it gets down to there's, again, back and forth communication is incredibly important. And there's a lot of ways to engage with the community to get a sense of what healthcare needs are at the top of everybody's mind. We can certainly do forums like this, which is fantastic. We can invite people to come to commissioner meetings and to share, thoughts and interests in that space and what they're looking for out of the commissioner in the hospital system. But we also can do things like look at what healthcare usage trends are present. That's a way to get a sense of what a community needs and to communicate in sort of more of a passive way. We can be thinking about what types of educational opportunities would be appropriate to get people thinking about why these are important things to talk about. It's one thing if you're listening to the same handful of individuals that is able to come out and knows about commissioner meetings or can speak out in specific venues or write editorials, but that's missing a lot of voices of people that may have strong preferences and not realize how important it is to express those. So I think it gets down to really being strategic and thoughtful about outreach and engagement with the people that aren't being heard.
Thank you. Ms. Force, you have 90 seconds.
So balancing community input with other sources of information, I really agree that it's time to do much more outreach to the community to find out what is most important. And also that's a great opportunity to make a two-way conversation or a multi-way conversation where you can bring back information about things that might not be under consideration by certain members of the public. And the whole community engagement field has lots of examples and ways of moving forward, and I think that that's what we need to do.
Thank you. Ms. Sanders, you have 90 seconds.
Here we go. Thank you. Well, let's start with some basic principles of democracy. Hospital commissioners are elected by the people. We are the representatives of the people. We stand for election in case of most hospital commissioners every 6 years. We are required to listen to the community. Now, when you step into that committee room, you are representing people. You know who is in your community. Then you meet regulations and financial realities. And this is where public policy and public officials and having to be representative of the people becomes an interesting mix. People may want certain things. I understand that. However, when you set it into into regulations and to financial realities, sometimes that's where compromise comes into play. But it is important that we as commissioners listen to our community, understand our community, and as been pointed out, recognize the needs of our community and translate that into what the hospital it can offer to the community.
Thank you. Okay, our next question. If decisions on narrowing services have to be made, what will guide your decision-making? As a board member, how do you decide what is least important? Access to emergency services, radiology, stroke care, reproductive health, death with dignity, pediatric care, orthopedic, etc. Ms. Coffin, you have 90 seconds.
This is also a really great question. I have to say I'm really enjoying all of these questions. So thank you for those who submitted them. So decisions around narrowing care. And I think it's really interesting that the question in it sort of framed that as specific services or specific areas of services. And that's not how I would approach it. I would approach it more in terms of looking at what parts of our care system reduce preventable readmission to the hospital, what types of services reduce higher level care needs long term, and be really focused on those things, because I think those are the things that reduce readmissions that are preventable and address preventable issues from coming up down the road are going to be most useful in sort of tightening the belt financially a little bit while also maintaining the critical services that the community needs. I think there's some systems that are in place around public health services that can kind of help identify where those areas are that could be really useful to take a look at. And so, I mean, the short answer is things that are preventative. Preventative care services are the things that I would focus on maintaining because those, again, are going to help reduce the incidence of more serious health issues and more costly health issues long term.
Thank you. Ms. Force, you have 90 seconds.
Yes, I would also take a little different approach and talk less about what services we don't focus on and what we absolutely must have here in the community. And those include primary care. A huge focus on primary care to help keep people out of the hospital in the first place and to help people stay out of the hospital, as Tara mentioned. Emergency care is essential. Surgery is essential. Maternity care is essential. And then what we have to do is look at what's left in the dollars bucket and what's left in the costs. And I would hope that we're in a crisis right now, and I would hope that as we move forward with this, that we will get to a place where we can create a sound foundation for the future. I don't see this as a permanent situation, but it's where we're at right now.
Okay, thank you. Ms. Sanders, you have 90 seconds.
Thank you. Of course, the first and logical thing most people would do is to look at usage and to identify what are the items that are so widely used that we absolutely need to keep them in our service opportunities. And then ask the questions, how can we be more effective? How can we be more efficient? I really am a proponent of looking about the community and the broader community and looking for opportunities where we might partner, where we might share services. And I'm thinking about, for example, sharing a practitioner, sharing a specialist, so that we still have the service in the community, but we're not bearing the full burden of that service. I think there's a great opportunity for being very strategic in those kinds of opportunities. We need to be creative. We need to be collaborative. We need to look at who can be dually trained so that I hate to say get a 2-for-1, but the fact that if somebody is dually trained, there is an opportunity there to use their skills across a much wider spectrum. It's going to require really looking in a proactive manner and not just saying, oh my gosh, isn't this awful? Let's be proactive.
Thank you. Ms. Benson, you have 90 seconds.
Thank you. Well, I think it's essential that we see what services are being used, such as the emergency room, obstetrics, and things like that, get those numbers, but also to see what's going out of the community. And we can do that. There's a way to find that information out. Where are people going when they can't get the services here? And I think we need to look at that very carefully. And one other thing that I've been on this kick for a while, but I think really looking into telemedicine for our hospital would be amazing. It would solve a lot of problems, particularly for the folks that live out in Clallam Bay and some of the more remote areas. It would be great if we had a very vigorous, vibrant telemedicine service that doesn't require, a whole lot of bricks and mortar. It's pretty low overhead kind of thing. And I think we could provide a lot of services that way now that we have better broadband throughout the county. That would be something that we should, and in partnering with our colleagues in Seattle and for specialty kinds of things, as we already do for movement disorders and neurology and things like that. So that's something that we really need to be looking at.
Great, thank you. Our last question in this series: public hospital districts have a legal requirement in Washington to provide abortion services as long as there are doctors willing to provide them. That could change if OMC were no longer a public hospital. What will you do to secure access to reproductive health care in our community? Ms. Force, you start. You have 90 seconds.
Well, I think first of all, we stay a public hospital district. Almost all of the options, except I believe for private equity partnerships, would allow us to do just that. I do think it's really important to look at any partnership with non-secular or faith-based institutions. They generally have agreed to write policies that more or less meet up with the law, but I'm not sure how that actually works in practice. If they have hiring decisions, are they going to hire physicians who are willing to provide abortion or not? And abortion is part of full spectrum healthcare for women. It is an essential service.
Thank you. Ms. Sanders, you have 90 seconds. You need to unmute.
I'm in such trouble with that. As already noted, public hospitals are required to provide abortion services, and indeed they are at Olympic Medical Center. However, non-public hospitals are still governed under the laws of the state of Washington, and they are required to ensure that anyone who is requesting reproductive services, abortion, that those services are made available to them in a way that is not burdensome. So the point is that the services are going to be supplied. They're going to be part of any type of discussion of anyone who is going to be part of providing services to this community. because again, it is a requirement in the state of Washington, and it is certainly one of the issues that our community has spoken about, and it is an issue that needs to be made available in the community.
Thank you. Ms. Benson, you have 90 seconds.
Well, thank you, Penny, for clarifying the position both of the non-public versus public hospitals requirements for that. I did not know, but it's really reassuring. I know everybody's very concerned about partnering with some faith-based organizations that may prohibit abortions in their facilities, and that's something that we definitely need to consider when we're looking at partnering or being absorbed by or coordinating with other facilities and other entities.
Thank you. Ms. Coffin, you have 90 seconds.
I want to kind of build on what Penny was talking about a little bit. I'm not as optimistic that there are the laws in place to make sure, but I think that it's a really good point. There are the Emergency Medical Treatment and Labor Act, for example, is Washington state law that mandates that all hospitals must provide emergency care, even if that emergency care happens to be abortion care, or to ensure that that is not super burdensome to access. But that doesn't and isn't always inclusive of elective reproductive care. And I think that's where there is sometimes, I mean, we live in a state that it's a good bubble to be in if you are a believe that everyone should have access to full spectrum of care, which does include abortion services. But there are still instances where churches, hospitals that have certain religious affiliations may not make the elective services as easily accessible. And I think burdensome is a really critical word to look at, because a burden looks different depending on where a person is coming in from. And there's a lot of statistics that speak to that historically marginalized populations, underinsured individuals with Black and brown skin, these are folks that have historically encountered more burden. And even if that burden looks the same as it would for somebody like me, it still is too big of a hurdle.
Thank you. The next group of questions deals with the roles and responsibilities of a hospital commissioner. First question, how do you view the role of a board member? How can the board support the executive team effectively? Ms. Sanders, you're first. You have 90 seconds.
Well, first, we always laugh about this. The board has one employee, the CEO of the hospital. And it is our role as a board to make sure that the CEO functions appropriately for the effective and efficient and service-oriented operation of the hospital. And then it is up to the CEO to ensure that the employees that report to him or her are following the policy and the principles that the board sets down. They always say we're a policy board, but there is power in policy. Organizations speak through their policies, and that is where our board has to work very hard, and we do, to make sure that there are the strongest operational and financial policies in place so that our chief executive officer has clear direction from us as to how we expect the hospital to be operated in a manner that serves the community. When you look at it that way, the responsibilities of the board are immense. We have to ensure that our direction is clear and that the person who is authorized to speak to our direction is doing that. Thank you.
Thank you. Ms. Benson, you have 90 seconds.
Well, in addition to the responsibilities that Penny talked about, the board also has to make sure that the hospital is following regulations. There are a ton, as you well know, both national, state, and regulations on how to take care of patients, how to document, how, what you need. And I think that the board is sort of the oversight on a lot of that. It's what the board needs to be able to do is to make sure that we're following good best practices in our hospital, that are the people that are working there are qualified, that they have a good background, that they, that everything, all the pieces actually come together, and that we make sure that we are providing excellent health care for this community, not just adequate. But we do need to follow regs, and we do need to be fiscally responsible and look at some of the contracts and things that are presented to the hospital. For example, lately they've been talking about the laundry contract. And I think that that's important for the board to weigh in on, is this going to work for us? Is this something that that is a good approach to taking care of the laundry situation?
Thank you. Ms. Coffin, you are next. You have 90 seconds.
I'd add on to what Penny and Carleen have said, and say that I think that an additional role outside of the ensuring regulations are adhered to and all of that is to provide opportunities for our constituents and our community to be able to share their voices and share their opinions and thoughts, and serve as kind of a translator between the regulation world and the policy stuff and the community. And that's both ways, not only being able to think of creative and innovative ways of ensuring the community understands some of the impacts of these policies, but also making sure that the policies are responsive to what the community is actually asking for. So that again kind of just goes back to ensuring that there's opportunities for back and forth communication between those worlds, since a lot of times healthcare policy, I have a degree in public health, and I remember having to go through and sign up for paid family leave or something, and I'm thinking I should know how to do this, but I am completely lost. And if there's opportunities to ensure that there's improved public health literacy, and I think the board is really, really well positioned to do that in an amazing way, especially in a community that we have within Port Angeles and the peninsula. And I think that that's incredibly important, is to create those opportunities for translation and communication.
Thank you. Ms. Force, you have 90 seconds.
I also thought it was really interesting that when I looked over a job description of the board commissioner, that the one supervisory relationship is with the CEO, and I hadn't thought of it that way before that. A good CEO, a good supervisor has a very strong relationship with the CEO that's not antagonistic, but at the same time is extremely searching and inquiring, because it's just essential that that the decisions made at the management level do meet both policy and regulations. For me, it's the weakness, I think, of what I've seen so far from the board is related to community engagement, and that's just critical. As public employees, publicly elected officials, we are accountable to all of our constituents, and they are, I'm not seeing the timer, so there it is, signal at me if need be. And so we need to, I think I'm out of time.
Sure, thank you. Okay, next question. Turnover can impact board effectiveness. What is your availability for board meetings, committee work, and other organizational events, including fundraising? Ms. Benson, you go first. You have 90 seconds.
Well, since I will be retired for the second time by the time the term starts in January, I am pretty much available. We live here in this community. We do some travel. We have grandkids in other parts of the state or other parts of the country, but one can be available via Zoom for meetings when you're not in town. So I definitely plan to be as available as possible. I don't have much more to say on that.
Oh, okay. Thank you. Ms. Coffin, you have 90 seconds.
So I do have a full-time job, but my full-time job is working in healthcare regulation. And so there's beautiful overlap there. I also am somebody that has flex hours and have the best way to describe it would be to be a immensely forgiving, erratic schedule and a propensity to try to do as many things as I possibly can. So my daughter has come with me to board meetings already, and this is something that I'm really, really excited to be able to incorporate into what my life and what my week looks like. This is something that I want to make space for in a meaningful way to be able to engage in this position if I was lucky enough to be elected as one of the commissioners. So I mean, it's sort of a logisticy question to answer, but the short answer is it's something that I'm really excited about incorporating into what my life looks like.
Thank you. Ms. Force, you have 90 seconds.
Hi, I also have plenty of availability. I'm retired. My other volunteer engagement includes serving at Olympic Peninsula Community Clinic and working with master gardeners. And I have 2 grandkids in Seattle. That's actually where I'm speaking to you from today. But other than that, I am happy to be a homebody. In fact, I decided I'd probably get a couple of cats if I am elected to this position because I've been missing them.
All right, Ms. Sanders, you have 90 seconds.
I will just say that I was a bit surprised about how much I did not know, because I have been coming to board meetings for 19 years and I've been looking at budgets and I've been looking at this. But what I have come to discover is being a board member is a tremendous commitment of not only time, but energy and being concerned about healthcare in the community almost all the time. Because, you know, we've talked about this. When I'm out in the community, people are talking to me about healthcare, and they want to make sure they have healthcare in this community. So therefore, as a board member, I was prepared to understand that there would be needed hours ramping myself up to understand policy and regulation and the kinds of things that boards have to deal with, as well as, truthfully, how the hospital really runs. OMC has 1,500 employees. It is a huge operation. And as Carleen pointed out, the discussion of the laundry, while seen maybe trivial to some people, the laundry services in this hospital are essential to healthcare. So board members have to spend a good amount of time studying, but they also have to be dedicated to attending meetings and attending committee meetings. It's important work.
Thank you. Our next question. What are your expectations of this board and the organization? How will you evaluate effectiveness? Ms. Coffin, you go first. You have 90 seconds.
All right, so 2-part question. What are expectations and evaluating effectiveness? So expectations would be to keep conversation going with the community and ensuring that the board is supporting decision making that is in alignment with community interests as well as policy and public policy specifically. In terms of evaluation, there's a lot of different ways we can evaluate whether or not we're doing our job well. There's quantitative means where we're just sort of asking some yes or no questions. Did we meet this criteria? Did we fulfill this specific goal? But I think some of the qualitative mechanisms of evaluating effectiveness, which involve listening to stories and listening to lived experiences of those 1,500 employees working at OMC, of our community at large, of all of the people that are making up the nuts and bolts of what OMC is. Being able to talk to them and to engage with them in different ways. There are a lot of approaches for doing that in a systematic way that develops quality data. And those stories are often more important, in my opinion, as somebody who's worked in research for a number of years, than just a data point. The stories are the things that help to capture those that are often not heard. And I think that's critical for evaluation.
Thank you. Ms. Forrest, you have 90 seconds.
So expectations of the board, I'd like to see a constant focus on the realities of our financial situation. I would expect to see a budget review on a much more frequent basis than is occurring right now. I think when the hospital is in such critical financial straits, the board should be looking at the budget on a monthly basis. I think we need to focus on community and transparency. Those are essential parts of the board commissioner practice, and evaluating effectiveness. I agree with the idea of a combination of both research-based questions and individual stories as a way to get at that. But we can also set specific goals for what the hospital is doing, for what the board is doing, and then look at them on a measured basis to determine if we're meeting those specific goals.
Thank you. Ms. Sanders, you're next. You have 90 seconds.
Thank you.
Yeah.
Well, let's start with the financials, because that is an important factor in supporting anything that happens at the hospital. You know, without money, there's no mission. So therefore, we do have to stay focused on the financials. And I would like to see our financial reporting much more timely and targeted toward making improvement over time in our financial position. That is a critical activity. We've kind of minimized that tonight, but improving the financial position of the hospital is critical to the hospital's success. One of the things I would particularly like to see is better feedback from the people who use our services. I would agree with you, Tara, we need both qualitative and quantitative services or evaluation. In this way, we can know where we're being successful, but more importantly, we're able to identify those soft spots that may need improvement, that something's not quite right here, but we can't do it without listening to our community. And then we listen in a way by asking them for their opinion of what their experience was. And if they had a bad experience, let's hear about it. And let's talk about how we can improve service and care across the entire hospital.
Thank you. Ms. Benson, you have 90 seconds.
Thank you. One of the things in running at this time for the commission is I'm hoping if I get elected, that I'll be part of the decision-making process as to how we're going to partner and what this is going to look like in the future, whether it's going to be critical access or whatever. So that is one of the goals that I have, is hopefully that decision won't already be made by January 1st. And those of us who would be coming on the commission new would be part of the decision-making process in where the hospital's going. As far as I like the idea of both quantitative and qualitative evaluations. Our patient experience people do a very good job with that right now. And I don't know if you're familiar with them, but they really do an excellent job. If people have a bad experience, they are really very, very good about talking to them and working with the providers, practitioners, or whatever to make things whole for patients that may have had a bad experience. I'm not a big fan of those questionnaires that you send out to people after they've had services, like the Press Ganey stuff, because that can be used against people in a very unfair way. But there are probably other quantitative types of questionnaires that we could utilize to get some feedback from the users of the hospital.
Thank you. Our last question: the medical industry is complex. How will you stay updated with changes and advancements related to this field? Ms. Force, you have 90 seconds.
Okay, the medical industry is indeed complex. I find that about a third of the podcasts I listen to are related to medical issues right now, and I read extensively, and I think that all of that is absolutely key to keeping up. This is a moving target, and whether you're talking about insurance or the types of procedures that are being done, that it's a huge range of issues we're talking about.
Thank you. Ms. Sanders, you have 90 seconds. You need to unmute.
I'll begin with unmuting. I'd like to quit calling it the medical industry, because that's a problem. We are an organization, a business. I mean, that's as close as I want to come to calling it an organization that's about care and about providing service and about making people feel better, trying to heal. I know that sounds a bit Pollyannish, but I think the fact that we keep calling it an industry takes away from what the essential work of any caregiving group is. But however, one of the keys here is staying updated on what is happening in medical care across the country. I have been particularly focused on reading the data, reading articles about hospitals that are similar in demographics to OMC, how they are adapting to change, what are key issues with them, how are they being successful, or how are they dealing with the challenges that the current climate presents. The current climate is a challenge at every turn. And we were not in this climate 6 months ago, but we have to be able to understand and focus on understanding what is going to be defining our work in the future.
Thank you. Ms. Benson, you have 90 seconds.
Thank you. Well, as a physician, continuing medical education is mandatory, and that's been part of my life forever. So staying up on things is second nature for me. And I read a lot of articles from online, from the New York Times and other various publications, Wall Street Journal. I'm also very involved in our state urology society. We do a lot of advocacy work, and it's a great networking thing. As Penny, like you say, we need to talk to these other hospitals. What are they doing that's working in this state or other states? We're not alone. Everybody's dealing with the same financial issues, but some people are doing it better. And I think maintaining a network of other folks outside of our community that are dealing with the same problems is really going to be essential for a commissioner to do.
Thank you. Ms. Coffin, you have 90 seconds.
I love this question. I've loved a lot of these questions. Let me tell you, I am a hoot at parties because I love talking about healthcare. For better or worse, my husband would be cackling right now if he could hear this. I have been in public health research for well over a decade. I produce public health research. I read public health research for fun. Laurie, I want to hear the list of your podcasts because that is totally my jam. Also, I love medical history podcasts and stuff. So this is something that I really like to engage with research. I have conducted community needs assessments across Washington State for specific healthcare interventions. And so I'm fascinated at looking at community-based data and getting a sense of what that tells us for where there are healthcare provider shortages, healthcare service shortages, and what that means for those specific communities. And particularly when it comes to looking at historically marginalized populations. And if that's not a phrase that you're familiar with, that's when we're talking about folks that are underinsured or that lack health insurance completely, or that maybe only have a catastrophic insurance plan. And so anything preventative is out of the window because it's too costly. That's also thinking about people who, when they go into the healthcare setting, they don't see healthcare providers that look like them. That is a barrier. And I love looking at data that tells those stories and helps us come up with solutions.
Thank you. Candidates, it is now time for your closing statements, which will be in the opposite order from your opening statements. So we'll start with Penny Sanders. You have 1 minute for your closing statement.
I want to share 3 critical words: accountable, access, and care. That underpins what a community hospital has to offer. What I am asking from you in this community is I am asking you to support me in my effort to continue as a commissioner so that I can continue to be committed to those critical issues: care, access, and accountability. Those are the factors that we need for a strong, vital hospital, which is essential to the welfare of everyone in our community. And I want to thank you for this. Was a really terrific conversation, and it was a conversation. Thanks so much.
Thank you. Laurie Force, you have 1 minute for your closing statement.
Thank you. I believe in reality. Our hospital is not on a great adventure to the future. We are fighting for survival. We face hard choices ahead. We must continue to find operating efficiencies. The board should be reviewing monthly budgets and getting more information for decision making. I believe in transparency. I've noticed that discussion in public meetings is limited and votes are unanimous. This does not meet the intent of our sunshine laws. It does a disservice to our community, and it doesn't help the hospital either. The issue before us has potential to cause deep, permanent rifts in our community. It is time for open forums where the community can get our questions answered. I believe in community. OMC is vital to our health and vital to our economy. We have to find a way to stay alive.
Thank you. Tara Coffin, you have 1 minute for your closing statement.
Well, I just have to say thank you to all of my folks also going for election. I don't think the voters have a bad choice. You know, there's no bad choice present. So thank you to all of you for that. and for being here and being so engaged. And I have absolutely delighted in this conversation. In terms of the things that come to mind that I think are the most important to me is improving public access engagement. So making sure more members of the public are able to engage in these conversations, bringing the mic into the community. We have to be thinking about innovative ways to ensure community members have their voices heard. And I think it's also another focus of why I'm interested in this position is to make sure that we are working to support evidence-based, policy-sound decision-making that ensures we maintain critical preventative healthcare services across the full spectrum, including reproductive healthcare, early childhood and family services.
Thank you. Carleen Benson, you now have 1 minute for your closing statement.
Okay, as I said in my opening statement, I love taking care of patients. And if I get elected as commissioner, I can take care of patients still. I can hopefully drive us through the providing excellence in healthcare, which is the hospital's motto. I want to contribute to that still as for everyone, not just the urology patients. And I've had experience in administration. I've been chief of staff. I've been chief of surgery. I work with advocacy with the state and national urology association. So I think I have the skill sets that are needed in addition to my medical knowledge, and having been in the community for 33 years now, I think I have what it takes to have a good background to be able to serve as a commissioner and make this community the place that I love, and I want everything to work out for us.
Thank you, everyone, for listening to this focused policy discussion tonight. And thank you, candidates, for your thoughtful answers. These candidates have taken the bold act of running. Now it's our turn to do the voting. If you are not yet registered to vote, we encourage you to go to votewa.gov and get yourself registered, either online or by mail through July 28th, or in person at your county courthouse until August 5th. If you're not sure about your voter registration status, you can check it on the votewa.gov website. If you want more information on the candidates, we encourage you to visit vote411.org to read the candidates' written responses to a variety of questions. Ballots will be mailed out July 16th and can be mailed in or placed in one of the many drop boxes throughout the county. Election day is August 5th, so be sure to fill out your ballot and get it either in a drop box or in the mail. I'm asking everyone to vote, then talk to everyone you know about voting. Make sure everyone has a plan to get a ballot in. This forum has been recorded, and a link to it will be posted on both the website for the League of Women Voters, Clallam County, in a few days. Once we have it posted, be sure to spread the word among your friends who are unable to join us live, so everyone can be an informed voter. Thank you again to our candidates for your participation in tonight's forum. Good evening, everybody.